All right. Hello, and welcome to another episode of Telehealth Tuesday. I'm Dr. Michael Bookhart, and we have a very special guest co-host with me who will be announced as soon as she enters the room. We have sent her an invite. She should be popping on your screen very soon. Most of you that have seen, um, most of you that have seen the posters and the announcements who've been following along. We appreciate that. You have definitely seen who she is. But for those of you who are just now tuning in, please stay tuned for something very, very special. Let's see. And we should have this person on here in just a second. And there she is. Ladies and gentlemen, stand and cheer for the
You are so crazy.
incomparable Melanie Sanders.
Hey y'all, how
Oh,
you doing?
all right. Can y'all hear? Can you hear? Melanie, can you hear me?
I can. My makeup looking a little light. Oh, okay, go ahead.
Yeah. Let's see here. They got some. Okay, we don't want to use that now. And you said I don't know if it was, maybe it's just me hearing you just a little bit soft on me hearing you.
Oh, you can't hear me?
Yeah, I can hear you, but it's just faint. But that might just be, how we have it set up
Oh
there.
my goodness.
Yeah, my settings are
Amy, can you hear? I see Amy Marta's
I see
on.
Amy's there. Can you hear Amy?
Hold on, let me close my doors too because I don't have my earpiece. My earpiece went kaput, so
Oh,
usually
really?
I like to have my earpiece in. Hold on just a second.
Oh, yeah. Okay, no problem. No problem. We thank everybody for coming on with us. Thank you all for watching, tuning in. Again, this is another episode of Telehealth Tuesday. Each and every Tuesday, God willing, 7 p.m. Central Standard Time. 1 hour episode podcast, 7 p.m. to 8 p.m., where we will be bringing you the latest and greatest when it comes to health and updates in our community, and especially things that impact our community. And by our, I'm talking Black folks. So again, we will have in the weeks and months to come. Please stay tuned to all of our channels. You'll be seeing all of our announcements. We have fabulous guest hosts such as Melanie Sanders. We've got some up and coming local doctors, local experts, state health officials, and various personnel that you do not want to miss. So looks like Melanie's back with us here. And
Yes.
again, ladies and gentlemen, if you don't know, allow me to introduce the Melanie Sanders.
Hello. Hey, everybody. Welcome. Thank you so much for having me on. You know, I love a good old chat. So thank you. I think we're going to have a good time.
Oh, yeah.
Yeah.
Awesome. Absolutely. And can you guys hear pretty good? It just might be my, I don't know
Oh,
if
you can't
somebody want
hear
to
me?
comment in there. Let me
Oh my
pull
gosh, let me
those
see.
comments. Let me
And
go
I
there.
can't see who's on, but just let me know if it's anything that comes through. I don't see any chat yet. I did see Amy pop up for a moment, so maybe that was just when people pop up, I'll catch it. So.
Okay, there we go. Enable.
Oh, okay. Hey, Reba.
Can we
She
see?
said she can hear. It sounds okay. Is it too
You
much?
can hear,
Is it
yeah.
an
See, I
echo?
just can't, I don't know why I can't see the comments on this one.
Okay. And I see
Let's
Amy,
see.
she put in hers too.
So you can see the comments?
I just saw Reba's comment, and then I also saw Amy I saw her comment initially, and then I saw the hearts come up. Okay. Reba says it's fine, keep going. And then I see your thing that says text. Mm-hmm.
Okay, yeah, I just can't see the others. Well, if you can see, then if somebody asks a question, then please feel free to let me know. But anyway, ladies and gentlemen, again, welcome to Telehealth Tuesday, where, as I was stating, we bring you the latest and greatest in our for issues that affect us. And by us, we are talking about African Americans especially, but we're certainly talking about all people. We don't leave anyone out. Telehealth Tuesday is a podcast. This is episode 4. And again, for those of you who are just joining, we will be having various experts, not just in Jackson, but a lot of people from around town, Jackson, Mississippi, and the state at large, state health officials. We have celebrities such as Melanie Sanders and others that will be announced. So please tune in to all of our channels. We'll give those to you a little later on. So let's get right to it, Melanie.
Okay.
Tell us about yourself. I think for all of those that do not know anything about you or who you are, I can't imagine who that would be. But please give us some of your background and tell us about where you've been.
Okay. Well, Melanie Sanders, obviously, as you can see, I am from Vicksburg, Mississippi. I'm a native of Vicksburg. I'm a graduate of Spelman College, and I've lived in Atlanta for many, many years. Was crowned Miss Atlanta, and that kind of started my journey in the entertainment industry. Well, actually, I really started when I was a teenager because I wanted to be a singer. So I started doing pageants, which led me to being a Miss Mississippi, and then later on, winning the title of Miss Atlanta. I've done American Idol season 1, and from the being in the front of the camera, that was fine, but I enjoyed the behind the scenes as the years went on, and I ended up creating Lux Life PR, public relations, and that's my business now. So I kind of have recently been doing a little bit of both, in front of the camera and behind the camera. I have to say I do love being behind, but it seems like recently I've been kind of forced to be in front of the camera. So I have just gone ahead and just let go, and you know, I've been trying to keep things kind of organized, being the talent and the person that handles the talent. It's a very unique situation. So, but it does tie into health, because I have seen where being in your best health is imperative when you want to really tackle all the things that life brings you. It's just, I mean, it's no way around it. That's the biggest blessing you have, is your health. So we'll talk a little bit more about that, because I've run into some things that I'd like to discuss in my journey to improve my health. So that's a little overview.
Yeah, absolutely. Absolutely. Well, and I think she might be holding back a little bit, but I know you can't talk too much about this big time show on Showtime that you're going to be. You have a featured part in, and also
Yes.
you are part of one of the local reality TV shows here. You have been on what, 3 seasons of Bell Collective? Is that right?
Yes, that's right. It's
Yeah.
been about 3
So
seasons.
let us know about this. Is there something coming up on Showtime that you can tell us about?
Yeah. Well, I definitely was not thinking that I would be getting into acting. I've done acting in the past. I've done some independent movies and things like that, but I was contacted about a role on this very popular show on Showtime. And I couldn't believe it. I was just like, okay. So I auditioned for it. And, I've auditioned for 100 things before over the years, be it the singing or whatever. And so when I auditioned for things, I just kind of let it go. But when I got the call back that I actually got the role, it didn't even compute. I was in New Orleans hosting an event for Essence when I got the text message, and I was thinking, okay, they want me to come to this place to audition further. I didn't realize that I actually had the role for this particular episode. So it's just one episode and it's one role, but it's coming on Showtime, and it's something that people are very familiar with. So it's one of Showtime's, probably one of their biggest shows. So I was really excited to come in as a guest star for that. It was a blessing. I was like, me? Okay. Yes.
Yeah. That's amazing, and
Thank you.
congratulations on that.
Thank
So
you.
we just wanted to give you a little bit of background, and for anybody out there who hasn't seen the other 3 episodes of Telehealth Tuesday, my name is Dr. Michael Bookhart, family medicine doctor here in Jackson, Mississippi, board certified in family medicine. I've been a hospitalist for going on 8 years, and we, together with two other partners, we have opened a facility called Good Faith Wellness Center, where we are seeing people. We will be seeing children as well for vaccines and routine, either well baby visits, routine annual exams for children. But right now we are seeing adults of all ages. It's comprised of myself, Dr. Torrance Green, board certified internal medicine physician, and also a nephrologist, which is a kidney specialist, and Dr. Sophronia Stidwell, who is a licensed chiropractor. And we will soon, we will be offering IV hydration. We'll soon be offering dun, 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 medical marijuana.
Okay.
So that's right. That's right. So that is, please stay tuned for that at Good Faith Wellness Center. So let's get on right to it, Melanie.
Okay.
Let's talk about something plaguing the African American community, which is diabetes. I think you and I talked about this just a little bit, and you told me that you wanted to share something that was very personal to you about your family history, and also an ordeal and something that you've even faced with this disease.
Yes. Yes. So, diabetes runs on both sides of my family heavily. Okay. And I always heard about it, but I was just, you hear it. And then I have to be honest with you, because I've always been slim, I didn't think, I basically thought that meant I was healthy. Right.
Yeah.
So, years went on, and here I am in my 40s, and I did begin to put on weight. Still in my mind, I'm in denial. I'm still thinking I'm skinny, but that wasn't the case. So fast forward on to, I had an automobile accident in October. So when I had the accident, I went in to get treated and everything. And so I ended up getting a physical while I was there. And I found out that I was on the edge of being considered pre-diabetic. So I was like, okay, first of all, I didn't even really know what diabetes was, okay? As much as I've heard it my whole life, it's everywhere. You see it on the commercials, all of that, right? But I
Right.
still didn't know what it was. And let me tell you something very telling. I asked one of my family members, what is diabetes? And even they were unable to really explain what it was or what it is. So one of the things that it wasn't a doctor who diagnosed me as being on the verge of pre-diabetic, and that was a number. I forgot what number it was, but it wasn't exactly pre-diabetic. It was like a few points from it or something, or point something.
Right.
And so he was a physician assistant.
Okay.
And listen, when he sat down next to me to tell me about this, it was as if he was about to tell me that I had cancer or something like that. It was very dramatic. I was scared out my mind, and I was like, okay, so do I have it? What does am I close to pre? Is pre, what does pre mean?
Right.
All those things.
Right.
And so that's what I wanted to talk to you about, because number one, what is the best way to describe what diabetes really is? Because people who have it can't even describe it. They just know that it's serious business. And to even be close to pre-diabetic, or teeter in the scale, or be pre-diabetic, whatever you want to call it,
Right.
all of that was serious. So I'm sorry to be so wordy, but I'm just trying to give you details.
Hey, look, please take all the time you need, because sometimes I can do the same. And so I know that on our first two episodes, sometimes people they would try to get in some questions, and I'd be kind of, going on about the topic. So look, please take your time. This is, Mikasa is Sukasa, So
Okay.
take your time. But
Oh,
wonderful question. Go ahead. You got
I'm
a
sorry
question?
to interrupt you, and I'm
Go
glad you said
ahead.
that, but I just want to let you know that thank you, Jamal. Jamal says great topic, and Brittany Coleman says that she's noticed that she's been shaking when she eats. Now, I don't know if that has anything to do with, just make a little note of that since we're
Yes.
on the topic. But I just
Absolutely.
wanted to let you know that. But go ahead.
Absolutely. No, and please look, since this is, our first time on it, please, if I think you might have something you look like you're writing. If you want to write down the questions, but also feel free to, hey, pressing question. Feel free to interrupt me and say, hey, we got a hot question here. Because look, to everybody again that's here, this is what we want. This is the purpose of Telehealth Tuesday. This is our service, to the community. Nobody, we're not getting paid here. There's nothing like, there's no fee for service. There's no copay. So you can come on here, judgment-free zone, and ask any question. No question is off limits. So, please feel free. I can't, the only thing I can see is that different people are watching, and it gives me the opportunity to bring them in with us. So so it looks like that you're able to see the comments or questions. So please, Melanie, let me know. And if anybody does want to come on, we can at any time bring a third person on Facebook Live to either ask your question or make a statement with us. So
Okay.
yeah, but in terms of shaking, that's a tough one, and it's kind of a multifaceted question. You've got to get a lot more history than that. So let's say if somebody is shaking, so the obvious things, okay, let's talk about temperature. That's the obvious thing. Is somebody either feeling, do they have cold intolerance, meaning that they can't tolerate being cold, which leads us down to another pathway where we start looking at conditions like, hypothyroidism in certain, cases. So thyroid conditions. It looks like did Melanie, did you drop off, Melanie? Let me see here. Let me try to, let me, I don't know what happened there. I think she somehow kind of dropped. Okay.
Oh,
Okay. There we,
sorry.
oh, there,
I was
okay.
wondering what happened. I'm like,
Okay.
go ahead.
There we, okay. Okay. There we go. Okay. Okay. Oh, you could hear me the whole time?
Oh, yeah.
Okay. So that kind of, that goes into a whole nother thing. So shaking, is a very subjective thing. What could be causing the shakes? You have to look at metabolic disorders. You got to look at infection. You got to look at other things. So could a person's potassium be off? Could it be too low? Could it be too high? Could a person's sodium level, which is the salt level, could it be too low or too high? Could they have a thyroid condition in which we would check a simple blood level called a TSH, a thyroid stimulating hormone? Could it be other additional things such as drugs, not necessarily street drugs or illicit drugs, but what other type of drugs is a person on? So I would just say that the shaking, if we can, to the person ask that, if you want to give us more information, we'll be glad to address that. But now going back to the diabetes, so diabetes, Melanie, I'm glad you brought that up. Diabetes is something that affects millions and millions of Americans, as we know, and I'm pretty sure that everybody on this live with us that is under the sound of our voices has somebody or some relative or some friend that has been affected by this condition. Now, the good thing is that, like every time I go somewhere, Melanie, whenever I've done talks or speeches, and we were even today, actually, this morning, they think they aired it at 5 p.m. on WAPT News. Shout out to WAPT. They were talking about stress levels in the stress levels in today's parents, in society. And the reason why that came up was Dr. Vivek Murthy, who is the U.S. Surgeon General, talked about the cause and effect relationship. They talked about the effects of stress, specifically focusing on today's parents and what that causes in them. And I related that to the fact that it's associated with high blood pressure, hypertension, diabetes, and even in the older population, we're seeing a lot more of Alzheimer's, dementia. And so that there is data, clinical data, that shows that there is a link or a correlation between that, which is a terrible, just it's a constant worsening, even if it's a slowly progressive disease, but nonetheless, it is a disease that is not reversible. So Alzheimer's, dementia, we have been seeing a lot more cases. And a lot of times, we can look at so many different things, at the family history and all this other stuff. But Dr. Murphy was showing, he was specifically talking about people developing such conditions and cardiomyopathy, which is a heart disease, diabetes, high blood pressure, and also Alzheimer's related to stress specifically. And, again, tying it back into diabetes, diabetes is diabetes insipidus and diabetes mellitus. The insipidus is the one that focuses on a sodium or salt disorder, which we don't really, see. It's not as common. But what we do see all the time, diabetes mellitus, and you have type 1 and type 2. And a lot of times, type 1, back in the day, we were taught, and even in medical school, that type 1, everybody says, oh, those are the people that take the shots or that are on insulin. And in type 2, are not on shots. And that is certainly no longer the case, and it has not been for several years. We certainly have the majority of people that I see are type 2, and probably 50% of them are actually on insulin. And this disease is something that is just a terrible systemic thing that affects people. It affects all the organs in our body. It affects, so you can have vision issues, you can have headaches, you can have kidney problems where people go on dialysis. You can have you can dialysis. You can have things that affect your heart, which causes heart disease, leading to that. And so that's, you had asked about the definition of diabetes. So that's exactly what it is. This metabolic disorder that most people call it the sugar when we're talking about diabetes mellitus. And this disorder causes an inability with the body either to metabolize the glucose or the sugar in the right manner, not being able to either produce insulin or not being able to absorb properly. And either way, this condition that affects all these different body parts called diabetes mellitus is something that we do see it, family inherited disorder, but we also see it, especially here in Mississippi, especially with people with this terrible diet. And and also, you talked about pre-diabetes. So diabetes is hemoglobin A1C 6.5 or greater. Pre-diabetes is 5.7 to 6.4, in that window. And so these are people, just like it said, pre-diabetes, that do not have actual diabetes, but in the wrong clinical scenario or setting could be on their way to diabetes. But in the right scenario, where this is a person who's, oh my goodness, let me get serious, I got a family history, let me work out, let me change my diet, these people usually do well, and they can reverse that, and they can get out of that pre-diabetes and get back to a healthy lifestyle. Oh, wait a minute. I can't. I think you might be muted. I think you might be muted.
Oh, how about now?
All right. Yeah. Perfect.
It was on my end. I don't even know what happened.
Okay. Yeah. That's
But
good.
if I have diabetes,
Mm-hmm.
and I have reached 6.5 and over,
Mm-hmm.
oh, and somebody says gestational diabetes too. Yakisha Baker just made mention of that.
Absolutely.
And Antonio Ward, we hear you too. I'm going to get back to your question, Antonio.
Okay.
But the if I have diabetes,
Mm-hmm.
is that it? Like I can't reverse it. If I have it at 6.5 and the next time I come and see you, I'm at 5.5
Mm-hmm.
A1C. Does
Yeah.
that mean I still have diabetes, or my numbers just got better? Has
Yeah.
the damage
That's
been done? Has the
it.
damage been done?
Yeah. Well, that's an excellent question. I'm glad you said that. I'm glad you asked that. So the good news is that no, it is certainly not a death sentence. It can be a death sentence to, like I said, in people in the wrong situation, such as those who, we might label them as hard-headed, and patients that are non-compliant and just won't do right. They won't take their insulin, or they run out of their medicine. They don't know who their doctor is. They don't know what pharmacy they go to. We see a lot of those patients. So those people, unfortunately, we do see them on a significant decline, and they go on to develop retina issues with their vision. Sometimes, like I said, if you think about family members or friends that you've had or church members, you see them saying, oh, my vision and I can't see. It attacks the optic nerves, attacks the retina. People who talk about neuropathy, so you got numbness, tingling in your feet. And then, of course, even more serious ones that go on dialysis because of the damage it's done to their kidneys, and heart disease and heart attack. and even strokes, and later, unfortunately, death in some people. So that's the bad side. The good side, though, Melanie, is that yes, it certainly can be reversible. It is certainly treatable. But like I said, that takes hard work and dedication. It can be done.
Okay.
If you got to the point where, say, your A1C is 10 and 11, which we see a lot of people like that in the hospital, those are people who just simply need to stay. I think you're still on there, Melanie. I'll see if you come back. It just kind of disappeared, but those are the people who, as long as you stay with what your doctor has ordered, prescribed, say if you're on insulin, you're on a pill such as metformin, then you need to ADA diet, so usually 1,800 calories to 2,100 calories, kcalories in a 24-hour period. If you stick with that and you are vigilant, you are serious, you're going to the gym, if it's 15, 20 pounds, that we pretty much all of us need to probably lose that. But if you stick with it, if you stay with it, you can definitely get out of the grasp of diabetes. And I've had some patients, I've definitely had some patients who, matter of fact, I had a lady who, I'm gonna send you back in. Matter of fact, I had a lady who was okay. Oh, there. I had a lady who was actually 80, 89 or 90 years old, who 89 or 90 years old, who actually had been on insulin, I think, for 30, 40 years, something like that. And I was so happy when I was a resident doctor at the university at UMC, when I was able to walk in the room. She had an A1C of like 5.8. And so we had
Okay.
gotten her, yeah, we had gotten her down from like 9 to 8. And over like a year and a half time span, she was down to barely the pre-diabetes level. And so when people who are 75 and older, we actually go ahead and let their glucose ride a little higher, because it's
Okay.
dangerous to have them too tightly controlled. So when I saw
Oh.
that she had an A1C of 5.8, immediately we took her off. And she was, like I said, I think she was turning 90. And she said,
Mm.
"Oh my God, I cannot remember the last time when I was never on insulin."
Wow.
Yeah.
And that's so scary. That's the part about diabetes. Obviously, the part where it'll affect all your organs. I mean, that's a no-brainer. That's terrifying to think. But
Hmm.
then just putting in perspective that there is a chance that you will have to give yourself insulin every day. That alone was
Hmm.
like, whoa, I had to drop like almost 30 pounds. No joke.
Right.
Like I was really scared.
Absolutely.
And so, like I told you, the way that he delivered the news to me it was dramatic,
Yeah.
but it caught my attention because I
Yeah.
was like, okay, I need to get myself under control.
Yeah.
So thank you so
That's
much for
right.
explaining that. I
Yeah.
really, I needed to hear an explanation. We had
Absolutely.
Antonio Ward had an interesting question. And do you mind if we switch
Antonio.
switch gears now?
Oh,
Can
oh
I?
yeah, absolutely.
Okay.
Yeah, Antonio, we just, and I'm excuse real quick, we did just a quick plug. We were just with Antonio, his church down in Huntsville, Alabama, Pastor Stokes. Yeah, we were just we just did a telehealth Tuesday. The church, they asked me, they were having a men's focus, a men's health.
Uh-huh.
So they asked me to come on as a guest on their platform. That was at 6:15, and then we transitioned right into Telehealth Tuesday. And then
Okay.
Antonio, Pastor Stokes, I saw, I think, one or two other gentlemen, they joined us, and they may be on tonight. So again,
Mhm.
thank you all for joining. But all right, take it away.
Okay. All right, Antonio, welcome, welcome, welcome. Thank you for all that you're doing.
Mhm.
His question was interesting, and I know that I'm going to, this word is just, okay, it says, any reason why a vegetarian would have triglycerides, have triglycerides reading in their blood work? High triglycerides, and I'm thinking that's how you say the word. I don't know. High triglycerides.
Yeah. Hmm. Yeah.
Okay.
Okay.
What is
So
a
one of the
triglyceride?
That's right. Yeah, triglycerides. Yeah, that's right. Triglycerides. So that's what. So when you run a lipid profile, which is what we do for all of our new patients at Good Faith Wellness Center.
Mm-hmm.
And by the way, we're going to have a point of care lipid profile machine, so you'll be able to get your full printout in 3 minutes before you leave the clinic. 3 minutes. We're
Oh,
going to have that technology soon. So,
okay. 3 minutes to get your entire
your
what now?
so the lipid profile includes the triglycerides,
Okay.
the LDL, which is referred to as the bad cholesterol,
Okay.
the low density lipoprotein, the
Mm-hmm.
HDL, which is referred to as a good cholesterol, which is what people they take krill oil and fish oil, all that kind of stuff to raise the
Mm-hmm.
good cholesterol, and then your total cholesterol. So there's at least those four, and then sometimes there are certain machines and laboratories that will kind of break that down even further. But those are the total cholesterol, triglycerides, HDL, LDL. Those are the main components of a lipid profile. So
Okay.
the question is, in a vegetarian, could you see the I guess he's talking about the elevated triglycerides in the blood, right?
Mm-hmm.
So definitely, that's a miss. So that's a great question, and I went to. Here's another plug for Oakwood University, which is a Seventh-day Adventist institution, Seventh-day Adventist institution of higher learning, an HBCU. So it's a small school in Huntsville, Alabama. My alma mater, wonderful place. And one of the interesting things was, since it's Seventh-day Adventist, and Seventh-day Adventists actually are known to live, when you look at the comparison, the data, living an average of 7 years longer than the average person. Uh,
Okay.
but yeah, in the world, because of the diet and health message. Now, certainly,
Mm.
not all of us follow that, but it was supposed to be so abstaining from smoking,
Uh-huh.
alcohol consumption,
Yeah.
unclean meats, unclean fishes
Uh,
such as catfish, pork,
uh,
yeah, all that. So,
all stuff we
so
love. Okay.
all that stuff, yeah, that they love down
Right.
here in the South. So,
Yes.
the Antonio's question about triglyceride. The funny thing is that Oakwood, even though this is a most the professors there, Seven Adventists were vegetarian and some even vegan. You would still see some of these people either with heart disease or elevated cholesterol, because the folks that, when you're a lot of people who don't eat meat or fried food, they substitute it with so much starch, so much dairy, so much cheese. Like I said, now that's not a vegan,
Mm-hmm.
but a vegetarian.
Right.
A lot of times they will just pile their plate up with pasta,
Oh,
piling it up with spaghetti, all that rigatoni,
guilty.
all that, yeah, and just Red Lobster, just killing the biscuits over there, and
Oh,
and
oh
macaroni
God.
and cheese. Yeah, so there
Woo.
was a professor at Oakwood
That's my type of
who
stuff.
that's the
Sorry.
good stuff.
Sorry.
Macaroni, yeah. And this gentleman, I remember seeing this guy, and he was teaching health principles at Oakwood, and he would go over there and pile his plate up high with macaroni and cheese. So
Oh.
that's basically my way of answering that. You can still have high cholesterol or high triglycerides even with being vegetarian, because like the good book says, if you're not temperate in everything that you do,
Mm.
you can always go overboard. Like you can
Mm-hmm.
get sick, you can
Mm-hmm.
die from too much or too little oxygen, you
Yeah.
can die from too much water, over dilution in the blood, and you can die from eating the wrong way, even though you're avoiding meats, even though you're avoiding sweets, fried food, all of that good stuff. But if you're piling on the carbs or the lactose, the cheese and all that, that is still another way
Mm.
to elevate your cholesterol. So it
Oh,
can definitely
oh,
happen
yeah.
in vegetarians.
And speaking of being of lactose,
Hmm.
okay, I have noticed that most African American people that I know are
Hmm.
lactose intolerant. And I don't know, like, is that something that you have researched or have heard is connected to African Americans? Because it's I've read it before. I didn't research it, but I've
Right,
definitely read that. And
right.
just like we are prone to have diabetes is for everybody, but we
Mhm.
are connected to diabetes. So
Right.
I've read even fibroids. African American people are more prone to that particular ailment, but
Hmm.
lactose intolerance seems to be something that most people I know
Yeah.
have. So,
Mm.
what's the deal with that? I mean, yeah.
Right, right. Well, you know, so with that question, I think we have to look at population that we're talking about. So in Jackson, Mississippi, I think we're what 80% roughly African American here, something like that, 78, 80. So the
Yeah.
majority of the people that we see, our church members, our family and friends are going to be, African American. I'm not really sure on that one if there's a direct correlation on whether more African Americans, but I will say that my personal practice and experience, I've seen more African Americans, but that's also because I see a lot more African
Oh, more
Americans.
African
So
Americans.
yeah,
Okay.
and
Okay.
the other thing to keep in mind is a lot of people, while they say, "Oh, I'm lactose intolerant," it might not be that they haven't had appropriate testing to actually diagnose that, because
Oh,
it can be made
okay.
on a clinical diagnosis, but
Okay.
you have to also see, well, what type of milk, what type of products are they taking.
Mm-hmm.
You have to look at that. What exactly are you eating? When are you eating it? What quantities?
Oh,
Yeah, so
okay.
it's really not, because some people might, it's the same as like when somebody say I have allergy, right? A patient will say I
Yeah.
have an allergy to uh, penicillin, and it's not necessarily that they have a penicillin allergy. It's just that they got
Mm-hmm.
a small rash, but it's nothing to be really concerned about. So I know a lot of times in our
Okay.
community we overuse the word allergy, and I think that
Yeah.
sometimes, yeah, not discounting. I'm not saying that these people can't be lactose intolerant, but a
Yeah.
lot of times we throw that around, and it's not always necessarily that.
Now that's a good point because I think that people in general do
Hmm.
self-diagnose. So it's like,
Yeah.
okay, I'm glad you said this. So
Yeah.
now that
Stay
is
away from
something that,
WebMD. Stay away from WebMD.
oh yeah,
Yeah.
listen, they will think, WebMD will have you think you about to go and see your maker, honey. But I do think that the lactose intolerance conversation, I hear it all the time, and people are always saying, "Oh, I'm lactose. Oh,
That's
and I
right.
have to
Right.
say, I've wondered, like, how do you know? How do you know? Just because, but like, those are good points that you made. You have to
Hmm.
factor some of those things are just, it could be a time of day.
That's
It could
right.
be something.
That's
Okay,
right.
that's cool.
That's right. That's
Cool.
right.
Let me see. Have I missed any other
Yeah. Keep them
questions?
coming. Keep them coming.
Let's see. Oh, guys. Okay, so I see Karen Flags Davis on. I see
Okay.
Keisha Stewart on.
Okay.
I see my mom, Debbie Sanders on. My sister
Oh,
Kiana Sanders, Pamela
welcome.
Stevenson.
Welcome.
I see all of these people. Do any of
Well,
you all have any questions? I know that Karen and I have we talked about different things over the years. Karen
okay.
is one of my favorite people. She is not only one of my dear hairstylists, but she is a friend.
Okay.
And as a hairstylist, you get to hear everybody's
Oh yeah.
health,
Oh yeah.
mental health,
Hmm.
every part of health you want to talk
Oh,
about.
absolutely.
Yes. So,
I know Karen got some question for. Come on, Karen.
Karen, you
I know
got
you got something
anything?
for us.
Keisha, anybody? And you know what? It's always I have questions all the time, like through
Come
my
on.
day.
Come
I'm
on with it.
like, I mean, So I know that you're special. Oh, hey, Michi, that's my cousin John July. Hey, Michi, I see you. Um, well, oh, okay. Let me ask you this. Now, I know that your specialty, you are a physician and wear many hats, but I have to ask about fibroids because let me tell you this.
Hmm.
I do not know. I know less women who don't have fibroids than I do with them. It's seriously, I know more women with fibroids than who do not have fibroids. Now, I'll say this.
Okay.
Years ago, and I've seen this study. I am not close to being a doctor or have the mind of a doctor. Let me just
Yeah.
say that, okay? Sharonda, oh, hey, Sharonda's still
Fib-
on. She said they are the
Fibroids
devil.
are the devil.
Listen,
Yeah, I agree.
I have to
I
tell
agree.
you, I did not know the severity of fibroids. And I was trying to figure out what is the link. You know, Black women are linked to fibroids. And I really questioned, what is it that we all do the same? And many of us have had chemical relaxers. I was trying to make that correlation. Like, this is early on before we read it. But I know it's got to be other stuff. What do you think? The fibroid, I mean, what is it about these fibroids? Have they always been around and we just now figuring it out? Is it the food? What is it? Because this is serious.
You know, that's an interesting question. I'm glad you posed that.
Yes, why
Why
are we
why
playing
we
like this?
play?
That's
Yeah.
what Sharon was asking.
You know, it is interesting, and I've seen a lot more patients that that where I've had to refer them to the OBGYN physician, the specialist, to help manage this. It's it is interesting. We are seeing more fibroids. You know, I am seeing more in my personal practice. I think there's a lot to be said for that. You know, of course, hormone mediated. So that's why a lot of times the first step in management, once you've effectively diagnosed, you know, fibroids, either if you've done whatever type of scanning you've done, whether it's scanning from the outside by doing an abdominal ultrasound, you know, basically taking pictures using the ultrasound machine, or you know, getting an even closer look, which with a transvaginal ultrasound, where they insert a probe in, through the vagina, and they look around, where you can actually you can get very close and take a look with that. That's really interesting. We've been seeing a lot more of that. There are certain things, with stress mediated, hormone mediated things that do increase that, so to speak. That's what the literature tells us. But it's also interesting, the management of fibroids, because, again, and I'm certainly not OBGYN, but usually, unless they're huge, the first step in management, once you've accurately diagnosed them, if a person is truly having symptoms, when that being lower pelvic pain, abdominal pain, changes in the menstrual cycle with bleeding, and then, like I said, also we know what's going on, that somebody's examined you, done a full exam. You would try medication. There's certain medications for that, including oral contraceptives or birth control.
I do remember hearing that.
Yeah,
Yeah.
yeah,
Okay.
because hormone mediated, and so changes in your environment, your stress level, probably diet has something to do, as well. But don't quote me just on that. But for sure, the stress, hormone mediated, sometimes even family history comes to play. The other thing is that I've been interested in this. Why so many women end up with hysterectomies, or actually the removal of the uterus, when a fibroid is a benign tumor that is usually located in the middle layer of the uterus, the myometrium. And a lot of times, again, first of all, they can be treated with medication. If not, if you do need surgery, there's a procedure where they can go in and remove the fibroids and still have you keep your uterus. The worst case, or the end all be all, would be if they're so large, if they're causing significant bleeding, significant pain, and nothing else has helped, then a hysterectomy, or removing a woman's uterus, should be a last resort. So yeah, that's my take on that. I think I think you might have muted again. I think you might.
Oh, sorry
Okay.
about that. I don't know what's going
Okay.
on. I
Yeah.
think when I moved the thing trying to see these chats,
Yeah.
but
It might be.
it's crazy because, like I said,
Hmm.
the fibroid thing. I mean, I I just know everybody. I'm serious. Like, almost all of my friends
Yeah.
have some issue with fibroids.
Hmm.
Okay, so
Yeah. See,
I have a
and Miss,
weird.
I'm sorry. Oh, go ahead with the
Go
question.
ahead.
I'll say, Miss Baker, Keisha Baker says, I wonder
Oh,
why a
Miss
lot of the
Baker, good
OBs
question.
go drastic. Well, yeah, hey, look, and look, I've talked to a OBGYN friend of mine. I won't name them yet, because a lot of you all do know her. She's a fantastic OBGYN physician, and their practice is actually located on the top floor of my same building. So we've reached out to her. Hopefully she'll get back with me and come on with us, Melanie, so she can. So yeah, Keisha Baker, if you could please save that same energy. Keep that same energy for when we have this OBGYN on, because, but like I said, not certainly not trying to call anybody out or step on any toes, but again, just in my knowledge of things, of medicine, hysterectomy is sometimes that's the first step for a very, very, very small subset of patients. But the majority of people, the first step should not be to have your uterus removed. And if it is, if that's the first thing somebody tells you, I would just question the doctor respectfully and say, hey, well, why do you recommend that? And if they, can't tell you, if they just say, well, this is the way it is, then I would respectfully suggest that you get a second opinion on that.
And right. And Sharonda says those fibroids in the lining are hell to remove from what I've been
Mm-hmm.
told.
Oh
And
yeah,
that is true.
absolutely.
That's scary too, because it's like,
Mm-hmm.
oh my gosh. I mean, the lining, and then it's so many of them. Okay, so just last week, or no, the week before last, same difference. A friend of mine came into my office and showed me pictures of her fibroids. She just had the surgery a month ago, I think it was. She's been out, well, no, I think she's been out about 6 weeks. But anyway, when I tell you to think, a lot of women don't even realize what's going on. Their stomachs are protruding as if they are pregnant, and they still don't know, because some women don't even have symptoms, period.
That's
They
right.
just got like, what's going on? And so
That's right. That's right.
yeah, that, and when I saw her fibroids, I was just shocked, because to me, you just have a little bit of space, so you
Mm-hmm.
think in that
Yeah.
area, and
Yeah.
and to know that these, whatever you call it, these things of benign, whatever, I don't know
Yeah.
what you said, I can't remember, but to think that they
Yeah.
can grow and be the size of
Mm-hmm.
cantaloupes and golf balls and all that kind of stuff. And like Sharonda's saying, a
Yeah.
big belly and being
Yeah.
painful, it's torture.
Mm-hmm.
You become a prisoner in your own
Yeah.
body.
Yeah, yeah, absolutely. And so, like I said, now in Sharonda, I see Sharonda's hammering on this one, isn't she? But look,
Yes,
Sharonda,
my
look,
friend knows.
and I scrolled. She said the lining are held. Yeah, they are, and like you said, surgically. I used to be a surgical technologist back in the day, so I used to work at a women's hospital, and we delivered babies. Of course, I was a surgical tech, so we did C-section deliveries, and then we did all types of procedures, cerclages. We did transvaginal hysterectomies, transabdominal. All the procedures that they do, I would assist them. This was a long time ago, but you're right. We only did a handful of myomectomies but see, when these patients came in, they were already so far gone, Sharonda and, Melanie, to your point, they were so far gone that, you're right. They were having lower pelvic pain. They were having a significant amount of vaginal bleeding. And, like you said, even sometimes you could even see that, protruding. And so, yeah, when you get to that point, yeah, now those patients absolutely are going to require a hysterectomy. But the thing is, once you get that far gone and say, because, these fibroids can certainly multiply and increase in size and pressure. And because of the anatomy, where the uterus is located, you've got the bladder, uterus, and the rectum, all those organs right there. When the uterus, when it gets so large, you can just imagine the problems that you can have with it compressing the bladder, pressing on the rectum, and women have all kind of other problems we don't even need to get
Yeah,
into. So, yeah, okay, Sharonda says
she's had
I've had
two.
two mild, yeah. So, yeah, and look, Sharonda, you're correct. So in your case, then like you said, and you said that it was hell for your recovery, then in that case, it sounds like, most likely then, you probably would unfortunately need to look at the other options, for you. So you're absolutely correct. And, I'm definitely sorry that you had to go through that. So, but thank
Yeah.
you. We appreciate you, Sharonda, for sharing this with us. Now, now, Melanie, does Sharonda want to come on? Because this is episode 4, and I've actually never had a third person come on. They just, they do their
Yeah.
comments there. Yeah, which we
I
appreciate.
mean,
But
really, Because Sharonda is well versed in this, and actually Sharonda and I,
Yeah.
we were at an event for my brother's keeper months ago where she was a guest
Okay.
speaker
Okay.
on this topic.
Oh,
And she
okay.
was definitely Sharonda said, no, Sharonda,
No,
no.
no. Okay.
Not the mic,
I was just
friend. You
gonna.
don't have to come in right now.
All right. All right. No. Okay.
But at some point, friend, if you want to, that'd be cool because it really is, a lot of women need to hear from women who have experienced it because it is something that we read about and all that. And they, to talk to somebody with that type of experience is something else. And Crystal's on here. Crystal, hey, you remember
Oh,
Crystal actually put on the event that I was talking about at my brother's keeper.
another day.
And it was
Okay.
just wonderful, just talking about women's health and just the things that we go through. But on that same
Okay.
tip,
Okay.
I have a question for you.
All right.
So,
Come on.
I am a woman of a certain age,
25.
and well, yeah,
25.
plus some, yeah. But anyway, I am definitely in my 40s. I am, just. Oh, Crystal says she's a fibroid warrior as well.
Five.
Crystal has
Yeah.
to
Five.
make sure you get Crystal on too, because she needs to talk about it. We need people that are
Well,
gonna talk about
look
this.
and look and hold it and you holding your thought because I got to say so. Are you holding your thought, Melanie?
Yes,
You're
yes,
holding your
yes.
thought. Look,
I got it.
Crystal, Dr. Crystal Logan and Sharonda Minor hyphen Cox. We need you all. And look, I know I've spoken with Dr. Logan on some other business things before. We appreciate everybody coming on here,
Yeah.
but we certainly appreciate y'all being, so transparent. And Melanie, look, I'm gonna look, y'all. I've enjoyed all 4 episodes we've had. I didn't even know it's almost 8, but look, we're gonna keep on. We can keep going right up until the time. But this has been such an exciting episode. I'm pretty sure everybody would agree if y'all can do some of those applause things for Melanie. Melanie, I'm sorry, I'm not gonna be able to take. I'm not gonna be able to take no for an answer because you're already on the flyer. I
Oh,
think we're gonna have to do this again.
okay.
So, Sharonda Minor Cox, Dr. Crystal Logan, we need you all on. We're going to have you all be our patient experts on this. And I'm going to also, she said, yeah, Sharonda says, yes, you're coming. And
And Crystal says she's back in town too,
okay,
so yes.
be reaching. Okay, please do. And I'm going to have the OBGYN. I'm going to call her tomorrow morning and see if she
Okay.
will help facilitate this. It's going to be great. Just y'all got to stay tuned for
Yes.
Telehealth too. Okay, go ahead. Take it away, Melanie.
Oh no, and it's still in the same vein, really. I am like I said, in my 40s, and I
Mhm.
can say that I'm well in my 40s at this point. However,
I don't
I
believe it.
have oh yeah, thank you. But I have made sure that I did not have any children. And I mean, for my own personal reasons.
Right.
But now I'm like, okay, I have done it all. Seriously, it's no excuse. I do want to have children, so
Okay.
what am I waiting for? And like I said, I'm in my 40s. I'm 43 to be exact. And I and
All
I
right.
don't, I'm not ashamed to say it. I
Yeah,
just, and 44 in
absolutely.
November. So
All right now.
now let's talk real quick.
Okay.
We only got a few minutes left.
Come on with it.
What do you say to the woman in her 40s
Okay.
that wants to have babies?
All right. Look, so this is going to be a great hot topic. I'm going to touch on it just for a
And we'll
second,
table
but that's another one.
it.
Yeah, well,
Okay.
what'd you say?
We'll table it. We're
No,
going to touch on it and
yeah,
then we'll bring it on to the next.
yeah.
Okay.
We'll bring it back. And like I said, I'm certainly going to read, especially, would you mind jotting this down or somebody who knows us personally, jot this thing down and send us a message. Because we want to come back to fibroids. We want to come back to your question as well, which would be termed. Now, look, this is termed medically
I know.
advanced age, mature, or high risk pregnancy.
Let's talk
Now,
about it. Yes.
yeah, so high risk pregnancy. Now, to answer your question bluntly and straightforward, yes, you can definitely still have children. It's certainly not too late. My mother, who I believe is on here somewhere, I won't tell all her business, but she was over 40 when I was born. Yep.
I love those stories. I want us
Yeah.
to bring somebody in who's over 40 who have
Okay.
had babies. Go ahead.
Well, maybe look, maybe maybe one day if Dr. Lily James is out there listening in the stratosphere, she will. I doubt it, but maybe she'll be willing to come on here. I doubt that one, but yeah. And my father was over 50,
Really?
so
Oh, Miss J, she's there. She says,
oh,
I'm here. That's your mom.
okay. That's my mom. Yeah,
Oh, that's
yeah,
awesome. Oh my gosh. So
yeah.
she was in her 40s. I love hearing these stories. This
Yeah,
is such
she
a
was.
motivating.
She was in her 40s when I was born. Um,
Awesome.
in the early 40s. But yeah, the answer is yes. Reactions are now enabled. You can, okay, okay. I just got a message from Apple. um,
Okay.
yeah, you can certainly have children. Um, you know, you know, everything is different. That's why I tell people there's no one answer on one person. There's always, that's the beauty of medicine. Everybody's different because you're 43. We've seen people like when I was a family medicine resident at UMC, they have a high risk OB department in there. And those people, I've seen some ladies in their 20s who basically had the fetus, the baby hanging out when they were walking in,
Oh my
that
God.
had no prenatal care and
Oh,
they were
Jesus.
only 25. Yeah, so the fact
Mm.
that some people have no prenatal care and they have poor what we call gestational dating, meaning that the dates so if somebody walks in, right, and they're either not paying attention to their body, or maybe they just don't feel a child when it gets to be that far along, they don't feel it moving, or so they just are completely unaware. Let's say if they come in and they're like 4 months, 5 months pregnant. I mean, that does happen. um,
Oh,
that's what we call poor, physician follow-up, poor dating. And so it's going to be hard to know exactly how far along. And that's when you just do the sonogram, which is the ultrasound, and just hope for the best. So that was
okay.
somewhat, that puts you in somewhat of a high risk. And that person could even be just 20 something. So it's not just the
Yeah.
age, but yeah,
Okay.
age over, 35 or so. Don't quote me on the exact age, but somewhere in the mid 30s on up is somewhat, is considered based on age alone high risk. Then you look at obesity, you look at heart disease. Are they diabetic? Are they hypertensive? And
Mm.
have they had previous pregnancies?
Yes.
Um, have
That's
they
good
had
stuff.
preeclampsia before? All that kind
Okay.
of stuff.
Okay.
And
Okay.
and then the other thing is, you have to look at the person. So being 43, if a
Mhm.
person is still having normal, every month 28-day cycles, or do you have any bleeding in between
Mhm.
periods, or is it is it perfect
Regular.
28 days and regular? You're not going through an large amount of tampons one time
Uh-huh.
and all that. So everything is regular. You've had good health care. You're not hypertensive or diabetic. Then yeah, I don't see why a person in their 40s could not, have a child and have a healthy pregnancy. Absolutely. But again, that would be a great question when we bring one of our OBGYN colleagues on to
Yes.
talk about it.
And I want to point out that your mother said that even before her birth, in her
Oh
40s,
yeah, that's right.
she had it's myosectomy. Is that the proper
Um,
way to say it?
yeah, yeah, myomectomy. Yeah,
Myomectomy, yeah.
yeah,
So I, I,
yeah.
I mean that right there, that gives me hope. That gives
That's right.
a lot of women hope out there who want to have children later in life and who might have had fibroid issues because it's very common. So
Mhm.
that's so inspirational. Thank you
Yeah.
so much, Ms. Lily. Thank you,
All
thank you,
right.
thank you for saying that.
Absolutely.
Hmm.
Absolutely. Yeah, I appreciate it. Thanks, Mom.
Thank
You know,
you.
um, and I see Yakisha saying 35, and then she said, go for it, girl. I guess she's talking to you about you.
Thank you,
Go for
Keisha.
it. Yeah.
Appreciate it. And I
Yeah.
did make that note, Yakisha, I made that note for the OBGYN about preventative measures that people can
Yeah.
take for fibroids. Because that's a great
Okay. Yeah.
question. I
Yeah.
mean,
Yeah.
it's a mystery to me.
Yeah. That's a great. I mean, because really, at least from a family medicine perspective, there's nothing particular that we would do for a female patient to just prevent. We just have routine screenings, and but by getting your pap smear mammogram, that's certainly not going to pick up a fibroid. So those things are kind of like incidental. So a person will pick up fibroids on a scan, say. So let's say if you're going to the ER and, having profuse nausea, vomiting, abdominal pain, you go over to the university or Baptist or wherever you go, and they might or might not, a lot of times they're going to certainly do a pregnancy test if a woman of menstruating age. And if you just say, oh my God, doctor, something isn't right, this is excruciating. And so at that point, they most likely they'll do a CT scan. They'll take a look. And so see, that could be an incidental way of finding the fibroids. Or if you're, going to see your OBGYN, routine, maintenance, or I mean, just routine pregnancy planning and everything. You found out you're pregnant, so they want to get the dates, and they do an ultrasound, either transvaginal or transabdominal, and then oh, we see you have fibroid. So that's normally the way it is. But there's usually not a there's usually not a way of just screening for it. But if somebody has a significant family history, like every woman in their family had fibroids, they're having pelvic pain, they're having some kind of issues with their cycle, then that should prompt the doctor to possibly look for other things.
Okay. Oh, well, that is wonderful, honey. This has been a wonderful chat. I have learned quite a bit, as well as the rest of the people tuning in, I am sure. And we are going to keep this thing going next week. I will be available next week. And I think
next week.
Well, we already know because we got the flyer and everything.
We got the flyer.
But it will be so good to hear from other people, bring guests on, let people share their stories, talk about, health, because sometimes we are ashamed to talk about certain things. And at this point in our world, we have to do whatever we need to do to make sure that we are healthy. Talk about it, get it out, because we are not living in a place that is looking out for our best interest or our best health, honey. If anything, they are looking to profit off of our demise, our sickness.
Don't even get me started, Melanie. Don't get me started.
Okay.
You're so right about that, and that's why we talked about, and again with the church in Huntsville with Antonio Ward with his they're doing the little, when you do the thumbs up, the phone does the thing.
Oh, is that what
it does it? Yeah.
Oh, wow. Okay.
Yeah. But yeah, that's something, man. That is why I personally got into, like I love surgery. Anybody that knows me knows that I actually wanted to be a general surgeon all my life. And my father was one of the first African American surgeons in Orlando, Florida.
Oh,
and
wow.
yeah, and I became a surgical tech, and I love it to this day. I did plastic surgery, women's surgery, but the good Lord saw fit for me to go into primary care, and of course I couldn't be happier because I got flat feet and I can't be standing up. My back start hurting. I can't stand up for hours of surgery.
Right.
But yeah.
Right.
So preventive care, which is what we do, we're supposed to do as good primary care clinicians, family medicine, that we're getting people in, we're screening for certain things, so that again, routine screening does not include fibroids and doing ultrasounds, but a lot of other things that some of which we talked about today briefly, like diabetes, hypertension. Those are things that I tell every time I do a talk anywhere. I say, isn't it a shame that if somebody dies or is stricken with a disease that could have been so easily treated or even preventable? And so there is no reason for us to, as African Americans in the most developed nation in the world, to be suffering from this, and at a rate that we're suffering here in the South. And so, like you said, Melanie, it's got to stop. We've got to change things, and this is the time to do it. So we're here with Telehealth Tuesday, so we can bring people forward in the transparency and solidarity, and so that we can come forward. And there's no question too bad. There's nobody that'll ever be shamed. Nope. Every question is a good one. And so, look, people, there's, again, before we sign off, there's no co-payment for this. We're not charging anything. This is free to the public. Everybody, not even just people in Mississippi. If you have relatives somewhere else, we want to see them. If you've got loved ones somewhere else in another country, we want them here. If you've got church members, like we said, Huntsville, Alabama, big shout out. We want them here. Oakwood University, we want them here. And so Um, this is the place. This is the place to be. This is where you need to come to get your health information. It is not a substitute for having a doctor or a primary care person, but we certainly can help hopefully guide you where you need to get. So, and if you don't have a primary care physician, if you need one, we are here at Good Faith Wellness Center, 2506 Lakeland Drive in Flowood, Mississippi, 39232, goodfaithwellnesscenter.com. You can also see this. We'll start streaming on Dr. B TV. And you can also go to Melanie Sanders on Facebook. You go to Melanie Sanders on Instagram. Let me know if I'm leaving anything out, Melanie. What are you, real quick plug, anything you're doing in the community or anything coming up?
Okay. Well, let me see. Is it September? Okay. Well, we do have some things coming up with the American Cancer Society. We are about to begin the Best Dressed Jackson nomination process, and that is the American Cancer Society, one of their biggest fundraisers here in Mississippi. And stay tuned. I'll make sure that I share as much information about that as possible.
Please.
Then there's also the 50 under 50 that Dr. Logan is going to be. That's coming up in December also. And I believe it's December, or is it? Yeah. So nominations for that is going on. So make sure that you look at Dr. Crystal Logan's page so you can find out more information about that. And of course, I'll be posting it as well. And oh gosh, I can't even think of it's a lot of stuff going on.
Yeah.
So that's just a couple of things that I want to throw out there. So yeah.
Awesome. Well, look, guys, I know we've gone a few minutes over time. Thank you for the people that are still here with us. And again, this is Telehealth Tuesday. Yep, Dr. Logan there. This is Telehealth Tuesday. Every Tuesday, this is where you need to be. And look, even if you have something to do, we always have our phones. So you can just log on in every Tuesday, 7 p.m. Central Standard Time, no matter where you are in the world. We are here, God willing, for Telehealth Tuesday. I'm Dr. Michael Bookhart. Our guest, wonderful guest host, Melanie Sanders. We want to thank her for her time. Thank you all for tuning in. We will see you all here next Tuesday on Telehealth Tuesday, 7 p.m. on Facebook Live. And remember, true wealth begins with good health. Bye for now.